The most accurate method of hemoglobin estimation is option A gasometric method, option B chemical method, option C cyan-meth hemoglobin, option D carboxy hemoglobin method, and the answer is option C cyan-meth hemoglobin. Increased PCV is seen in option A iron deficiency anemia, option B aplastic anemia, option C polycythemia vera, option D ITP, and the answer is option C polycythemia vera. All of the following are uses of WBC pipette except option A sperm count, option B platelet count, option C absolute eosinophil count, option D CSF count, and the answer is option B platelet count. Anticoagulant of choice for ESR estimation is option A trisodium citrate, option B heparin, option C EDTA, option D double oxalate, and the answer is option A trisodium citrate. All of the following can be estimated using Sally's method except option A HbA, option B carboxy hemoglobin, option C HbF, option D meth hemoglobin, and the answer is option C HbF. Ideal length of peripheral smear is option A 1 to 2 cm, option B 6 to 7 cm, option C 4 to 5 cm, option D 3 to 4 cm, and the answer is option D 3 to 4 cm. Ideal temperature of doing ESR is option A 20 to 27 degrees Celsius, option B 30 to 35 degrees Celsius, option C 38 to 42 degrees Celsius, option D 10 to 20 degrees Celsius, and the answer is option A 20 to 27 degrees Celsius. Which is the most expensive among the following anticoagulants? Option A EDTA, option B heparin, option C trisodium citrate, option D double oxalate, and the answer is option B heparin. In ESR estimation, ratio of blood and anticoagulant used is option A 1:3, option B 4:1, option C 1:4, option D 3:1, and the answer is option B 4:1. Ordinary Buffy code preparation is used for all of the following except option A demonstration of malarial parasite, option B detection of WBC disorders, option C detection of platelet disorders, option D LE cell demonstration, and the answer is option A demonstration of malarial parasite. In double oxalate mixture, ammonium oxalate and potassium oxalate are used in the ratio option A 1:2, option B 3:2, option C 2:3, option D 1:3, and the answer is option B 3:2. All the following tests should be done within 2 hours of blood collection except option A prothrombin time estimation, option B peripheral smear preparation, option C platelet count, option D WBC count, and the answer is option D WBC count. Which of the following are Romansky stains? Option A Leishman stain, option B Giemsa stain, option C Wright stain, option D all of the above, and the answer is option D all of the above. Thickness of most commonly used cover slip in improved Newbar counting chamber is option A 0.3 mm, option B 0.5 mm, option C 0.4 mm, option D 0.6 mm, and the answer is option C 0.4 mm. Diluting fluid used in WBC count is option A Pilots fluid, option B Rees-Hecker fluid, option C Hames fluid, option B Turk's fluid, and the answer is option D Turk's fluid. All are causes of thrombocytopenia except option A hereditary spherocytosis, option B acute leukemia, option C ITP, option D aplastic anemia, and the answer is option A hereditary spherocytosis. Normal reticulocyte count in adult is option A 2 to 6%, option B 3 to 5%, option C 0.5 to 2%, Option D 6 to 10%. And the answer is option C 0.5 to 2%. Increased osmotic fragility is seen in option A sickle cell anemia, option B hereditary spherocytosis, option C thalassemia, option D iron deficiency anemia, and the answer is option B hereditary spherocytosis. All are causes of eosinophilia except option A parasite infections, option B skin disease, option C allergic disorders, option D pyogenic infection, and the answer is option A parasitic infections. All are causes of microcytic hypochromic anemia except option A megaloblastic anemia, option B thalassemia, option C iron deficiency anemia, option D sideroblastic anemia, and the answer is option A megaloblastic anemia. Direct Coombs test is positive in option A iron deficiency anemia, option B hereditary spherocytosis, option C autoimmune hemolytic anemia, option D thalassemia, and the answer is option C autoimmune hemolytic anemia.